In this video, we will discuss how to take a history from a patient in the exam. While taking a history from the patient in exam, adopt a sympathetic, gentle, and friendly approach. You should adopt a conversational style rather than an interrogative tone. While taking history, you should start with open questions and allow the patient to tell his story. Moreover, communicate with the patient during exams in a language that he can fully understand. Avoid writing when the patient is talking and telling you important details. Keep yourself attentive while taking history. At the start of history taking, introduce yourself to the patient. Ask the patient to tell you his complete name. Later on, ask about the age, marital status, occupation, and address of the patient. Ask the patient, is he admitted to the hospital? If he says yes, then ask about the day of admission. It is important to ask about the route of admission to the hospital. That is through emergency or outdoor. Now it is time to ask about presenting complaints. Presenting complaint is the symptom that brought the patient to the hospital. Record the history of the patient in his own words. Never use medical terms. Remember, complaints should be in chronological order. That is from longest to shortest duration. Write the symptom which developed first at the top, followed by other complaints in the sequence of occurrence. Start with an open question. What was the reason that you visited the hospital? Can you tell me about your problem with which you visited the hospital? If the patient doesn't give you information at this moment or you stuck, ask the patient to tell you something more about his disease. Later on, focus on the history of the present illness. Ask about the onset, duration, progression, aggravating factors, relieving factors, and associated factors. For example, in case of pain, use this mnemonic Socrates. After this, make differentials. That is, ask questions to consolidate your diagnosis. For example, if the patient complained of shortness of breath, then ask questions to rule out each and every cause that may be responsible for shortness of breath. That is, rule out respiratory, cardiac, and renal causes to reach the exact diagnosis. This is the time for systemic inquiry. Note that the patient usually tells you only the symptoms that he thinks are important and wants urgent attention from a doctor. Consequently, he ignores other related symptoms which are associated with the disease. So, in systemic review, you can ask questions rapidly from head to toe that may be related to the diagnosis, which you are thinking. But remember, do not repeat questions here in the systemic review, which you already asked before. In systemic inquiry, at the start, you may ask about appetite, and weight loss or lumps in the body. Later on, rapidly touch the other systems from head to toe. After this, focus on past history. Ask about diabetes, hypertension, ischemic heart disease, or previous operations. For example, if the patient says that he has diabetes, it is important to ask about diabetes in some detail at this stage. Ask about the previous admissions to the hospital. Ask about treatment. That is, ask about previous and current treatment in detail. Note down the names, dosage, and duration of the drugs. It is important to ask about compliance with medication. Ask about Hakim's medications. Ask about previous surgery. Ask about allergies. It is important to ask about immunization status. Ask about family history. That is, anyone in the family having a similar disease. Ask about personal history. That is, smoking, alcohol, and extramarital relations. In some cases, you need to ask about addiction or drug dependence. But remember, before asking such type of questions, tell the patient that this information will remain confidential. If the patient is female, then focus on menstrual history. Ask about the irregularity of the cycle. Also, it is important to ask about diet, if you suspect nutritional abnormality. If the patient has a fever, then ask about close contacts having tuberculosis. It is important to ask about socioeconomic status. Occupational history is important sometimes, as there is the relation of some diseases with occupation. So ask about the exact nature of current job. Also, ask about jobs in the past. Travel history is important. Some diseases like malaria or HIV may be related to travel. I hope this video will help you in the exam while taking a history from the patient.